Hi guys, this is the Country Profile Project Part 2 for Sierra Leone by Valerie King, Tommy Moll, Gracie Readling, Anna Scott Wingfield, and Carleigh Jo Crabtree.
In Sierra Leone, non-communicable diseases, or NCDs, are estimated to account for 33% of all deaths, with 14% mortality due to CVD, 3% due to cancers, 2% due to diabetes, and so on. Some important factors to consider when it comes to these NCD mortality rates include physical inactivity, harmful use of alcohol, salt and sodium intake, and ambient air pollution. Tobacco usage, obesity, and high blood pressure are important NCDs, with tobacco smoking reduction being one of the main efforts of Sierra Leone in terms of NCD maintenance. The Sierra Leone government, with support from the WHO, became a part of the Framework Convention on Tobacco Control Project, or FCTC 2030, becoming one in 4 in the WHO African region to benefit from the initiative. FCTC 2030 aims to provide support to low and middle income countries for the implementation of effective tobacco control measures. Sierra Leone has committed to implement the FCTC by speeding up adoption of tobacco control legislation and strengthening coordination within the country in terms of implementation. A specific ministry, known as the Ministry of Health and Sanitation of Sierra Leone, has also initiated an FCTC national strategy to help guide implementation of the WHO FCTC. This demonstrates the more specific and targeted approach to implementation that allows those within Sierra Leone with a better understanding of the cultural assessment at the grassroots level to help with mechanisms of action. In addition, Sierra Leone drafted a new tobacco bill which would help protect the health of the public from exposure to tobacco smoke. The 2017 financial bill also included a 30% excise tax on tobacco products, which aims to reduce tobacco usage and its related NCDs. The Ministry of Health and Sanitation facilitated 2 important studies on childhood health behaviors: the Global Youth Tobacco Survey, or GYTS, and the Global School-Based Student Health Survey, or GSHS, which gathers information on students aged 13 to 17 years on alcohol and drug use, diet, hygiene, and tobacco consumption. Findings are to be used to implement and evaluate school health, youth and tobacco prevention, and current or possible control programs. Sierra Leone also commemorates World No Tobacco Day to promote the idea that tobacco is a threat to health and a proponent of NCD development.
Physical environment is a determinant of health, and while it does not exist in isolation from the other determinants of health, water pollution, air pollution, occupational hazards, unsafe buildings and roads, and other modifiable environmental and occupational exposures contribute to nearly 1 out of 4 deaths worldwide. In Sierra Leone, there are a multitude of environmental factors that contribute to health. Water, sanitation, deforestation, and natural disasters have all contributed to the health of the country. Additionally, the Civil War has resulted in damage to water and agricultural infrastructure, especially in rural areas. These areas also suffered from a lack of maintenance during the war, resulting in a lot of these rural areas having a lack of access to basic services, including healthcare. After the conflict, there was a lack of government response to the environmental issues, making it harder for the country to recover. Deforestation in Sierra Leone is a major environmental problem that can result in natural disasters and can deplete resources. Before the Civil War, 16,189 hectares a year were lost of tree cover, and after the war, 151,873 hectares of tree cover were lost per year. This is due to the use of slash and burn techniques used for farming that increased after the war. As people became displaced from their homes, they farmed for sustenance and cleared forested land to grow food. Due to the need for food by population that increased by 80% during the period between 1963 and 1990, more and more land is being used for agricultural purposes, and this puts a drain on the water that is available for human consumption. The mudslides that impacted the capital city of Freeport in 2017 took the lives of over 10,000 people and displaced over 3,000 more. Sugarloaf Mountain collapsed due to the deforestation and because unorganized settlements had been established on natural floodplain drains. Roads and bridges were destroyed and power outages were frequent. The destruction of infrastructure made it more difficult to get access to healthcare. After the mudslides, the fear of waterborne illness arose, and this led to the local government launching a cholera vaccine program that vaccinated over 500,000 people. Water can be a key to understanding the health of a country. Unsafe sanitation, unsafe water, poor hygienic practices, and the burden of diarrheal disease are closely linked. In Sierra Leone, water can be abundant during certain seasons due to the country's 7 rivers and 9 watersheds, but most of the water is used for agriculture or is unsafe for human consumption. There is also a long dry season. Less than 60% of Sierra Leone's population has access to basic water. Also, 20% of the urban population and 1% of the rural population has access to safe piped drinking water in their home. In 2016, the number of diarrheal deaths from inadequate sanitation was 3,269. Over 1,200 children under 5 each year die from waterborne diseases in Sierra Leone. Mining, sewage, natural disasters, and conflict can all contribute to water quality that results in water-related health issues.
Sierra Leone has one of the world's highest maternal rates at 1,360 deaths per 100,000 babies born. This high rate is caused by severe bleeding, hypertension, sepsis, obstructed labor, and more. Most of these causes can be prevented or treated by having access to quality care during labor and after delivery, quality prenatal care, good health and nutrition, and family planning. What is being done to reduce these high rates? The Emergency Obstetric and Newborn Care MONC training program has been revised and implemented in Freetown and 3 regional hospitals. The revision included making use of revised MONC curriculum, guidelines, and protocols. MONC aims to ensure that nurses, midwives, and doctors have essential clinical skills and knowledge needed to manage common childbirth-related complications. Through lectures, seminars, and practical exercises, WHO helped to train 50 facilitators and 120 clinicians in MONC best practices and was followed with intensive on-the-job mentorship and clinical training. Along with this, WHO has supported the ministry in strengthening nursing and midwifery education, accreditation, and regulation. Sierra Leone has also had high child mortality rates, with the under 5 mortality rate at 114 deaths per 1,000 babies born. Preventing and treating the underlying causes of child deaths is a priority for the country, with WHO providing particular support to the prevention and treatment of common childhood illnesses and strengthening the quality of pediatric care. What is being done to lower these rates? The Emergency Triage Assessment and Treatment ETAT program has been implemented to strengthen and streamline emergency care for children in the regional and district hospitals. Approximately 520 district hospital staff have been trained throughout ETAT, with 15 international clinicians and nurse mentors providing structured mentorship and on-the-job trainings to these teams over a 6-month period. Another program has been implemented called the Integrated Management of Newborn and Childhood Illnesses, IMNCI. This program aims to ensure clinicians have the required skills to manage common childhood illnesses and deliver essential interventions in preventative health. For all facilities, WHO supported the printing and dissemination of chart booklets and wall charts and provided assistance to a national IMNCI supervision exercise across all districts. Finally, 150 clinicians from 5 districts were trained to provide tailored youth-specific healthcare services through the adolescent-friendly health centers. This allows community health centers to have a health worker capable of providing tailored adolescent-friendly services.
Sierra Leone experiences a malnutrition burden among all populations, but especially in its under 5 population. As of 2013, the national prevalence of under 5 overweight is 8.8%, which has decreased slightly from 9.4% in 2010. The national prevalence of under 5 stunting is 37.8%, which is greater than the developing country average of 25%. Sierra Leone's under 5 wasting prevalence of 9.5% is also greater than the developing country average of 8.9%. Sierra Leone's adult population also faces a malnutrition burden. 48% of women of reproductive age have anemia, and 7.1% of adult men have diabetes, compared to 6.6% of women. Meanwhile, 13.3% of women and 3.8% of men are obese. In Sierra Leone, 47.2% of infants under 6 months are exclusively breastfed. This is well above the Western African average of 30.8%. Sierra Leone's 2015 low birth weight prevalence of 14.4% has decreased slightly from 17.2% in 2000. Increasing uptake of recommended breastfeeding practices is recognized as one of the most critical and cost-effective interventions to improve childhood nutrition and survival. Sierra Leone is especially vulnerable to the increasing frequency and severity of droughts, floods, and severe storms, and their impacts on sectors such as agriculture, fisheries, water resources, as well as infrastructure and hydroelectric power production. Such climate-related hazards are having increasingly adverse effects on the country, especially in regards to their impact on the agriculture industry. Because of the great periods of drought, food shortages began to emerge, negatively affecting the nutrition of the people. The risks on food security of strictly rain-fed rice cultivation cannot be overlooked. Shifting rainfall patterns have caused disruptions of planting seasons, resulting in diminished agriculture production and poverty amongst farmers in general. 3/4 of preschool-aged children and nearly 1/5 of pregnant women are deficient in vitamin A, 75% and 18% respectively. More than 4 out of 5 preschool children are anemic, along with 2/3 of pregnant women, 83% and 60% respectively. 45% of households do not consume iodized salt, leaving children in those households unprotected from iodine deficiency disorders. 57% of the population is at risk of insufficient zinc intake. Adequate intake of micronutrients, particularly iron, vitamin A, iodine, and zinc, from conception to age 24 months is critical for child growth and mental development. Very high rates of micronutrient deficiencies signal that dietary diversity is low.
Over half of the top causes of death in Sierra Leone were caused by communicable diseases, with malaria being number 1. Lower respiratory infections are especially prevalent in women and children due to indoor air pollution from wood and charcoal burning stoves. Contaminated water has made waterborne illnesses like cholera a problem. There are few places with access to clean water. In 2016, there were around 67,000 people living with HIV, with 26% on antiretrovirals, and it is estimated that about 2,800 people died due to HIV. In the diagram on the right, you can see an extremely simplified life cycle of malarial transmission. First, a mosquito carrying the malaria parasite bites a person. The parasite then travels to the liver and incubates there. Depending on the species, they can lie dormant for up to a year. Once the parasites have matured, they leave the liver cells and begin to infect red blood cells. This is when symptoms begin to present themselves: high fever, chills, sweating, headache, nausea, and vomiting. If a mosquito bites the infected person at this point, it will carry the parasite and start the cycle over again. Since the disease is transmitted through the blood, humans can pass malaria to one another from blood-to-blood contact, such as blood transfusions, organ donation, and bloody needles. Anyone in tropical climates is susceptible to malaria. The climate in Sierra Leone makes it especially prevalent. They have an average temperature of 25 degrees Celsius, which is 77 degrees Fahrenheit, with a wet season from May to October. They get an average annual rainfall of about 10.5 feet. There are many swamps in Sierra Leone for the cultivation of rice. These swamps contain the perfect conditions for mosquitoes to thrive. Malarial transmission peaks during May and October. Pregnant women and children are especially vulnerable to the disease. 4.4% of pregnant women and 17.7% of children under 5 had malaria in 2017. The President's Malaria Initiative was launched in 2005 over 15 countries in sub-Saharan Africa. Its goal was to reduce mortality from malaria by 50%. They did this by implementing 4 highly effective prevention and treatment tactics: insecticide-treated mosquito nets, indoor residual spraying, accurate diagnosis and treatment with artemisinin-based combination therapies, and intermittent preventative treatment in pregnant women. By 2011, there was substantial decline in under 5 mortality rates in all participating countries. Sierra Leone began this program in 2017. $15 million were allocated to this country's project. Increasing awareness and access to preventative measures as well as treatment will go a long way to eradicating malaria worldwide.
Thank you for watching part 2 of the Country Profile Project for Sierra Leone.